The Eastern Cape Health Department is leading the way in vaccine rollout. The province has inoculated 23% of its population. Health MEC Nomakhosazana Meth joins me now to talk about this and some strategies that they've used as a province for the high vaccination numbers. Good morning to you, MEC, and thank you so much for your time. When we spoke to the Limpopo province over the weekend, they were saying that their strategy of keeping things simple and tracking each healthcare worker on a day-to-day basis appears to be behind the strategy of getting the numbers we've seen them getting. What has been your strategy in your province? I think, MEC, you're on mute. If you can unmute yourself.
Sorry for that.
No
Good
worries.
morning, Bongiwe and the viewers at home. Let me start by expressing my heartfelt condolences to the families who lost their loved ones in a tragic bus accident that occurred yesterday, where 28 people of our province lost their lives and many people were injured.
And are you able to share, pardon me, MEC, before you move on, let's just stay with that just for a little bit. Are you able to share some details around this of those who are injured? Where are they? And what's the latest on the investigations?
Not as yet. I just know that the deceased were taken to a mortuary Woodbrook in East London, and the injured ones, some are in East London in hospitals like your Frey Hospital, and the others that were minor injuries were released home. So in terms of the investigations and what had happened, I don't have as yet the detail in regard to that. But I'm expecting that report because our teams have been hands-on. Even as we speak now, they are at the mortuary with the postmortem that they are busy doing.
Certainly a very bad accident there that we saw. But let's go then to this, good news. You got a mention as a province in the health ministry's briefing on Friday, and you are the province that is leading the pack when it comes to the vaccination drive. How are you doing it?
Firstly, let's say we are humbled by the fact that we were mentioned by the minister last Friday morning as the province that is leading in the country, having administered more than 23% vaccines in our province, which means we are more than one-third towards achieving the 67% herd immunity. And that we are saying thank you to our health professionals, to our partners and to our people at large, because if it was not because of the partnership that we are getting from our stakeholders, be it the private sector, the NGOs, the municipalities, the leadership of traditional leaders, churches, including our sister departments, and the hard work done by our professionals, and including the dedication and commitment that we are experiencing from our people, we have not been where we are today. So we are saying thank you to them. But we think behind the success that we are experiencing as a province, it is that partnership that has seen us to have increased number in terms of the vaccination sites, because now we are almost more than 1,200 vaccination sites that are operational, which is an increase when we look at what we're at in July this year. We are also saying we've got a lot of pop-ups that we are having, the sites that are also the weekend sites. We've got also the church halls and the community halls. So it's not only the fact that we are using our facilities, we are also in partnership with local municipalities using those church halls in the rural areas and the community halls. So we are saying thank you to the partnership that we since received from our partners. And we want to ramp up this program, because even though we agree that we've done good, in particular in July, we have since noticed that in August there's been a ditch where we saw a lot of decline. The numbers declined massively. And we think we are associating that to the fact that the vaccine was not available beginning of August. But we are seeing again now a pick up, because we were at one point at 38,000 vaccines administered a day. But now we are at about 25,000 There's time when we went even down to close to 1,000, but we are seeing our people coming back. But we think also there is a fatigue that we don't understand, because with the NPIs, we can understand the COVID fatigue, that people now are no more observing these protocols. But again, we don't understand why our people are just not interested anymore to come and take vaccines. And we are pleading with them to say we are almost there. If we are just more than 1/3 towards the 67%, it says there's something we're doing good. And our people must just continue to do that, because one thing that we can assure our people is that the vaccines are so safe to administer. And it has been proven scientifically, and we have seen it even with the health care workers who had vaccinated, because now the number of those who get infected has just stayed down ever since they vaccinated. And even those that have what we call vaccine breakthrough or vaccination breakthrough, they don't get that sick, and there's few that get hospitalized and they recover. So behind our success is the commitment of our people, of our healthcare workers, and also the partnership that we are having with our stakeholders.
I'm going to ask you to pause there for me, MEC, as we go for an ad break. When we come back, let's continue then this conversation with you as we look at how you've also addressed some concerns around vaccination hesitancy. Let's continue our conversation with Health MEC Nomakhosazana Meth. MEC, thank you for staying on. Let's talk then about, the issue that you alluded to. There does appear to be others who are not interested in taking the vaccine, but others are saying that they're hesitant because they may not have enough information with them at hand. How have you as a province addressed these issues of concern around vaccine hesitancy?
We must first appreciate the partnership with the media, because again, it has served as a voice for us to reach out to our people. As the province, we are having almost weekly a media briefing to report to the people what is going on, give them what is new, and also share the news about what is it that we are seeing as we continue with our vaccination. Because as I said earlier on, the fact that those who have vaccinated don't get sick even if there is vaccination breakthrough, it's something that is also giving some confidence with our communities to see that the scientific research that said this vaccine is safe to administer, and if you do administer it or get vaccinated, then there are limited chances for you to get ill or to be hospitalized. So messaging is one of the important issues that are a cause for our success. But I can't undermine. I want to emphasize, as if I'm overemphasizing, the partnership that is overwhelming that we are getting from our stakeholders, starting from the local government sphere. Because in all municipalities, starting from the districts to the local municipalities up to the wards, we are having what we are called joint operations committees, which are like a command council at a local level. But we're also having our own provincial command council, which is chaired by our premier. And as if it is not enough, we are also having what is called extended Premier's Coordinating Council, Command Council, where all other stakeholders and political parties are working together to share the information, to send this one message. So we are just a team that is united behind this across political affiliation, across organizations, across government and civil society, and even our business. Our business is doing great. If you can just imagine where in a mall there is no business and as such there are no tenants to occupy a particular shop, it just gets given to government to say this is a donation, we can make this a pop-up site or an extension site. So that is one of our key success stories, the partnerships. And partnerships have proven that if we work together, we can do more, because now we are able to communicate this one message with many voices and also share to people these success stories of saying, even if people get sick, but they don't get sick to an extent of being hospitalized. So I think even though our people, others, are still reluctant because of many reasons that are different, but the reality is that they can see that those who are vaccinated, they don't get sick like those who did not vaccinate. Who get sick, get hospitalized to the ICUs, and unfortunately others, they also demise. So communicating using all platforms is behind our success story in terms of dealing with the hesitancy.
And how challenging has it been to do this in the midst of a third wave? Because you didn't have low numbers at yourselves as a province.
Exactly, Mongiwe. Remember, we are a province that I think is known in terms of our challenges of human resource shortages. So we did contract more than 8,000 contract workers to deal with COVID-19. But when we thought the curve was flattening, we started refocusing those contract workers to vaccination and registration, because our health workers and health promoters, they are out there in the rural areas doing door-to-door, gave them unlimited data to use their gadgets and phones to register our people to come and vaccinate. But unfortunately, once the curve now started going up, in particular with the third wave, we started having to have an overstretched responsibility in terms of the human resources that we are having. So it is not easy, but I think with the support and the dedication, as I said, of our staff, we are able to multitask. In the meantime, we are doing tracking and tracing to ensure that every case index that we find, their contacts, they get traced and we do the testing. But at the same time, we use that particular human resource that is not enough to make sure that our vaccination program continues. So it's not easy, but we are trying all the best we can. But we also appreciate the support that we are getting from the National Department of Health and also from our partners like the Solidarity Fund. And also we have engaged the tertiary institutions. As you know, we've got many medical universities in our province. We are partnering with them. Our own Lilita College, we are taking the third and the fourth year students to come and assist us, volunteer in particular during the weekends. We've got almost more than 1,000 of those students that we have trained, additional to the contract workers that were contracted.
How was it, when working with various departments then in the province, looking at departments like the education sector, in order to ensure that those numbers are vaccinated, those numbers are quite large in the vaccination drive, especially seeing as a province as yourselves, you're quite, it's a rural province in large parts. Secondly, also, it's critical to get the education sector on board when you are embarking on a campaign drive like this one.
Actually, as you are talking to that, I want to appreciate the support and the partnership that you are having with the Department of Education. Because starting from when we identified the educators as a special category to be vaccinated, which I think is an approach of government that has worked. The one of having categories that we are focusing on, in particular when we are dealing with the public sector and congregation setting personnel. But we have since entered into a partnership with the Department of Education, even getting us some gadgets to do the registration and even committing that we can even use their schools for that. But unfortunately now there is this recent alarming school infections that we are experiencing. We are almost at 1,800 learners and some educators who have been infected. But we continue with the partnership as the department, with the Department of Education, and that is working quite well with us. So we are saying if we partner with all other departments, not just Department of Education, because there is great partnership we're also having with COPTA, with social development, because some of the areas that we are using as pop-up sites is the SASA pay points working with the Department of Social Development. And also COPTA is central to the partnership that you are receiving and support from local government sphere and traditional leadership. So I can say, even though it is important to work with the Department of Education, in particular during this time of these outbreaks and infections at school, but also the support you enjoy across government departments is assisting us.
And how concerned are you about these infections that have broken out in schools?
It's very concerning, Bongiwe. It shows that really education is a societal matter, because the schools are found in communities. It is linked to the numbers that keep on rising, because our kids are staying with their parents and grandparents and they go to school. It's unfortunate that even though government has tried to vaccinate educators and the personnel in the Department of Education, now we are faced with this. It talks to the new variant that is also now infecting in numbers our young kids. But we are talking with the MEC for Education as our teams are working together on the ground on the approach in dealing with this, because it's quite alarming and it's unfortunate that our children now must be exposed to this serious and invisible enemy.
And how is the province going to deal with a situation where you may see numbers reaching levels that you never thought they would reach? I mean, look at Gauteng. At some point, it was even at, over 13,000 cases in a single day, and thus putting a strain on resources. And you've alluded to the fact that your province is also one of those that has some serious constraints when it comes to resources, and you've redirected some of those contracted workers. Do you foresee a challenge should your numbers be more than what they are currently?
Of course, yes, Bongiwe, but what is key, which is what we are engaging at and focusing at now, is contact tracing, tracking and testing, but also the social mobilization and the partnership with our social partners to talk to our people to observe the non-pharmaceutical interventions, because with the level down having been made to be locked down levels 3 now from level 4, we're seeing that even the issues of sales of alcohol, they are contributing to the pressure that we are seeing in our hospitals. And now with the bed availability, oxygen availability, there is strain, but I can say still we are still faring well in that side in terms of availability of oxygen, because majority of those who get admitted in hospitals now are either in vaccinations or in ventilators or in oxygen. So we are saying the more the numbers are rising of infected citizens, the more pressure is going to be put in our hospitals. But we are doing all what we can to try to first use our facilities to ensure that we do what is called quarantine or isolation, because for now, as the province began, unlike during the first and second wave, where we were able to even use private sector hospitality businesses to accommodate those who must be isolated. We continue to encourage self-isolation, but as a rural province and a poor province, it's not always possible that our people who get infected in families are able to self-isolate and self-quarantine. So it's another pressure that we are looking at, that we must make sure that we provide, even if it's our hospitals where we think we still have some beds available for those who have tested positive, even if they are asymptomatic, for isolation and quarantine for those who have tested and await results. So it's quite a serious pressure that will be getting as the numbers rise. And as we see the numbers, in particular in the western part of our province, they are a bit stubborn, because Nelson Mandela and Sarah Batman have been having highest numbers in the province for quite some time now. But we are happy with what we have seen in the past few days, that there is a decline that we are seeing, in particular Nelson Mandela and Sarah Batman. But it's not something that we can celebrate as yet, because numbers, again, are at the tune of 1,400 a day for the past 3 days. Yet we have been experiencing numbers that are less than 900 to 600 in the rate of cases. So we are worried about the numbers, but we are doing all what we can to try to move with speed with the contact tracing, testing, as we run with the vaccination program.
All right, MEC, good luck, and thank you for your time this morning as we get encouraging news from your province that has inoculated 23% of its population so far.